The University of Wisconsin-Greenbay is currently training the next generation of nurses. Student Alayna Peterson is interested in oncology nursing and says having these nurses guide her through simulations helps.
They give us more of a, once again, like a real life. It's like we can learn this in the classroom, but this is how it's going to be in real life. So it's that extra bit of knowledge. The state of Wisconsin has been facing a nursing shortage for quite some time, but the university is hoping to turn that around with the use of a $376,000 grant.
We have a limited number of nurse educators, and so this opportunity is going to help fund additional positions as well as partnerships to have clinicals so that we can increase the capacity of nurses coming through.
UWGB hires nursing educators by training co-clinical instructors from nearby hospitals.
Right now we have 4 co-clinical instructors, and in the future I could envision doubling that number.
According to the Department of Workforce Development, the state of Wisconsin is expecting a 36% increase in the demand for nursing needs by 2040.
Especially with our baby boomers retiring, they're going to continue to be consumers of healthcare, and so there is going to be a demand not only in the Green Bay area but around the state.
Christine Vandenhouten says a part of the shortage could be due to burnout from the COVID-19 pandemic.
But in particular, healthcare providers who went to work every day facing individuals who were extremely acutely ill, it takes an emotional toll.
Peterson says it would help having more nurses around.
It's just more perspectives.
After partnering last month, ThedaCare and Froedtert say this is just the first step of their joint expansion.
This is a community that we think of as our backyard.
Each health campus is expected to have emergency care, inpatient beds, and 24/7 coverage. ThedaCare is based in Appleton and Froedtert is based in Milwaukee. Leaders of the 2 health systems called the future facilities modern, smaller-scale hospitals.
Most people nowadays can be taken care of in the physician's office, in an emergency room, in an ambulatory surgery center, and hopefully go home.
It's in the community, so it's much easier, better access. It's a smaller setting. Patients love that. We get very, very high comments in terms of how patients really love this setting.
The $110 million plan will build an 1,800 square foot facility near West Johnson Street and North Peters Avenue in Fond du Lac. A 5,800 square foot facility will be built on the corner of 6th Avenue and Jackson Street in Oshkosh. Mark Roloff, Oshkosh city manager, says having a hospital on the east side will benefit a lot of the city.
Having more people in the central city means that we do need more quality access to health care.
According to Claritas and the Wisconsin Hospital Association, around 72% of Oshkosh's residents live east of Interstate 41. Plus, generate 45% of emergency department visits. Most healthcare services are on the west side, meaning east side residents are more than 15 minutes away from a hospital or emergency room.
Having something come back to the downtown area is going to make it more, it's going to make it easier for residents to get this access to quality health care.
Fond du Lac's patient volume increased by 13.7% the past 2 years. ThedaCare president and CEO, Dr. Imran Andrabi, says the added micro-hospitals will help with wait times at other emergency rooms around the area.
This is now us going to the next level of providing care close to home.
A 75-year-old ice cream shop and a pizza bar are just 2 recent examples of Oshkosh businesses struggling to find workers.
That's brutal. I mean, I'm very thankful for friends and my daughters and their children, and that's kind of how we've been piecing it together.
It's been challenging. 35 years in the business, and it's never been like this.
Owners Michael and Christine Schra say the number of workers at Leon's Frozen Custard reached a low, causing them to shut down early on Wednesday. This prompted 2 Facebook posts, one a plea for more workers. But Leon's isn't the only business in Oshkosh that's struggled. John Damo, the owner of Zeroni's Pizza, has been working more than usual.
A ton of extra hours. It's a lot. There's not a lot of help out there.
Finding staff has been difficult at Leon's since the start of the pandemic, and although profits have stayed up, rising inflation has been an extra factor to consider.
The cost of our products that we purchase from vendors in some cases have doubled or tripled. And you can't double or triple the cost of a cone or a burger. It's hard to do that.
Schra believes Leon's will be all right because of loyal customers, but he still hopes to add a few more workers.
Things will turn around and get better. And, you know, the employees that we do have, we have a great team. And this is a great place to work.
But if more help doesn't come soon, he says they may close earlier for the season. He is encouraged, though, by the response to the Facebook posts. At Zeroni's, Damel doesn't know how much longer he can stay open while being shorthanded.
How confident are you in your ability to keep doing this?
50-50. 50-50. I mean, we all have our limits. And as much as you want to keep your business going, there's still a family that suffers at home. So sometimes you got to put your priorities there and take care of yourself.
Damel says he's already moved back to only being open 6 days a week to give employees a break.